Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
Which of the following medical conditions should be considered when a patient presents complaining of new onset episodes of anxiety-like symptoms including hypervigilance, tremulousness, tachycardia, and palpitations? A. Hypothyroidism, B. Insulinoma, C. Anemia, or D. Hepatitis? So, interesting question. I mean, we know, and of course you are taught in school, that whenever a patient presents with any symptom at all, we always need to consider a wide range of differential diagnoses. And in mental health, many of those differential diagnoses we have to consider are medical conditions. Classically, things like depression could be consistent with hypothyroidism, anxiety could be consistent with hyperthyroidism, but it's much bigger than that. We really do need to consider medical conditions as an underlying, as a potential differential, particularly if the rest of the patient's symptom presentation just doesn't clearly fall into traditional mental health diagnoses. I mean, if somebody presents with anxiety-like symptoms, but it really does not fall into a pattern that you would expect with generalized anxiety disorder, social anxiety, panic disorder, something like that, it is important to consider those medical conditions because there are several of them, not just hyperthyroidism. And you'll notice that hyperthyroidism is not an option here. So again, going back to the question, which of the following medical conditions should be considered when a patient presents complaining of new onset episodes of anxiety-like symptoms, including hypervigilance, tremulousness, tachycardia, and palpitations? So clearly this is a differential diagnosis question. Well, would you consider hypothyroidism? Not typically. We think of hypothyroidism as more consistent with a depressive state. B is an insulinoma, and B is actually the correct answer. And insulinomas are not common, but they do happen. And when a patient has an insulinoma, remember, is a tumor of the adrenal gland, and it produces insulin inappropriately, leading to clinical symptoms of hypoglycemia. This tumor can make patients hyperinsulinemic, and it can produce symptoms of hypoglycemia. And it's the symptoms of hypoglycemia that can mimic an anxiety attack. Tremulousness, pale, clammy skin, diaphoresis, elevated pulse and blood pressure, all of those classic fear, flight, fight response, because it is the fear, flight, fight response. So it's not common, but I mean, the common stuff is easy to figure out, it's easy to consider. The less common stuff is the stuff that gets missed. And with insulinomas, it's not as if they just get more and more hypoglycemic and then, they die. You have bursts of insulin release, so burst periods of hypoglycemia. And then the body compensates by mobilizing glucose and symptoms are relieved and the patient improves. And so it does present like intermittent episodes of anxiety for just no obvious reason. So it's definitely something to be considered. Rare, but dangerous. And so you always want to have it on your differential, particularly if the anxiety disorder or the anxiety symptoms rather, just don't sound like a typical anxiety disorder. Now, anemia, which ultimately can lead to hypoxemia. With anemia, you don't have enough of the hemoglobin that carries oxygen to peripheral tissues, so patients are clinically hypoxic. They're hypoxemic at a cellular level. That's more often associated with fatigue and depressive symptoms. They just have no energy. Could they ever feel anxious? Sure. If you're hypoxemic, it might make you be anxious, but B is a better choice here because C is more typically associated with depressive-like symptoms. And then finally, hepatitis in and of itself is not associated with mental health symptoms. Although, again, depending upon the level of disease, it could certainly lead to fatigue, lack of motivation, and those kinds of things that are associated with depressive disorder. But when you take the question and the 4 answer choices at face value, the one that really should be considered right off the bat is an insulinoma that can lead to intermittent episodes of hypoglycemia.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.